My collaboration with Kim came about with this one patient, a 5-year-old boy with severe developmental delay who had multiple dental infections in his mouth and had seen at least 2 dentists prior who were unable to treat him and recommended that he actually be treated in the operating room. And so I took a look in his mouth, and he was very uncooperative, very anxious, fearful, very sensitive in the dental chair. And I thought perhaps this may be a unique opportunity to engage the social worker. And so I reached out to Kim. What are your thoughts, Kim?
Well, one of the interesting aspects of this case was that it was a very brief intervention that made a dramatic difference in this child's ability to cooperate in the dental chair. Dentists spend a lot of time with children in the chair and work in a way that can be somewhat frightening to children, and the child's capacity to cope with that can be thought of as an early assessment of the child's development. If they were able to use that information to then help the parents and child address the child's developmental difficulties by bringing in someone who's an expert in addressing those concerns, it can be beneficial for the child's development, and it can be, of course, beneficial for their later dental health and mental health, as well as their overall health.
The role of the social worker in our practice is a combination of both chair-side behavior management and a pre-dental behavioral modification appointment, where they actually meet individually with the child and sometimes with the family as a whole and help them cope with dental care and other aspects of behavioral management. Having a professional like that on site kind of helps with that, and they could focus on the behavioral aspect of it, and we don't have to spend so much time on that and spend that time more wisely and efficiently on the dentistry. And that's actually more productive for the dental office, better for the child, and the parents are certainly very happy.